Hi, my name is Lucy DiCarlo, and I'm the National Manager, Patient Education and Support at the Leukemia and Lymphoma Society of Canada. This video is on chemo brain and fatigue, which we know are two common side effects that many cancer patients and survivors struggle with on a daily basis. Dr. Doris Howell is a scientist with the Division of Psychosocial Oncology and Palliative Care at the Ontario Cancer Institute. Dr. Howell specializes in optimizing the quality of cancer care and will be discussing the issue of fatigue. Below this video, you will see information on how you can get a free booklet titled Coping with Chemo Brain. Thanks, and enjoy the video workshop.
So I'm going to talk a little bit, as Fred said, about fatigue and some of the issues that patients experience. And I'm going to try and give you a little bit of the background in research, or what do we know about management of fatigue. And then Sam is going to speak about some of her research in this field around chemo brain and some hints and tips. And hopefully we've got a chance to talk at the end about some of your own tips and strategies for managing these problems, because often it's the patients and their families who actually have discovered some very interesting ways of managing some of these particular problems. So it'll be very interesting to hear some of your thoughts about that. So what I'm going to try and cover is just sort of a little bit of a, what do we understand about cancer fatigue? What is that experience like for patients and families, of course? Try and give you some of the latest research in a not so researchy type way around the interventions that we know about that can help fatigue, and also to talk about the role of the patient in self-management of this particular problem as well, because a lot of times it comes down to how we deal with the problem and some of the symptoms that we need to think about. So I don't need to describe to you that, in terms of this being the most prominent problem that cancer patients talk about is that sort of prevalence of fatigue and the issue of cancer fatigue. That does go on as a long-term problem once treatment ends. And of course, the pattern of fatigue varies by virtue of whether you've had radiotherapy, whether you've had chemotherapy, or by virtue of whether you've had a combination of those things, absolutely. But also it does go on for many people for many, many, many years post-treatment. And again, we're just really starting to understand the whole aspect of how long fatigue can be experienced by patients and their families who are coping with that alongside them. The really important aspect is, in terms of how we think about fatigue, and it's really important, even in your own book, we don't think about fatigue as a symptom, because the challenge, it's absolutely a symptom, but it's not one that you think about, well, it's a side effect of treatment and I know how to manage it because it's kind of co-occurs with everything that goes on in terms of what you've received in treatment. We actually call fatigue a syndrome, and you've got a very good example in your booklet about cancer fatigue as to why we call it a syndrome rather than just a symptom, because it doesn't just go on as a physical symptom of tiredness. It has all kinds of other symptoms and all kinds of experiences that go alongside it, and many, many different factors that might play a role. So it's probably important if you get a chance to look at that, because all of the different things that kind of go along with the experience of fatigue are part of that. So the definition that was put forth, similar to Marg showed the definitions from the National Comprehensive Cancer Center, or Cancer Network, is that it is described as a distressing, persistent, and of course it is a subjective feeling, and that sometimes makes it difficult to communicate and talk about fatigue, because how do you explain how you're really feeling when you experience this particular syndrome? And of course it doesn't necessarily it can be worse with recent activity, but sometimes you can just have it without actually having done anything on a particular day, which makes it the most challenging symptom that patients talk about. In addition to that, of course, it can interfere with a whole host of different things. It interferes with usual functioning. We know it's a significant burden to patients in terms of being able to return to work. We know that lots of times patients are not able to do a full workday because of their fatigue, and they really have to negotiate with their human resource groups to say, I really can't manage the mornings. Can we change my schedule? So return to work altogether, or even return to work in a sort of short-term capacity, becomes an extremely problem, because fatigue can interfere with that. It's also not that sort of, it's hard to describe, because fatigue isn't that normal fatigue that you and I might experience as just going through normal life. It's not that you get tired because you knew you exercised or you worked out or you did something that was actually fatiguing and drew on your fatigue energy bank, if you will. But it actually just stays there and doesn't necessarily get better with sleep or rest. So it's very different from the normal fatigue that many people talk about. And that's what makes it difficult, because sometimes when you communicate with your doctor that you're tired, they may be thinking about this in the perspective of their own experience of typical normal tiredness. And this is very, very different. It is a syndrome versus just that single symptom of tiredness that becomes important. The thing that patients talk about in particular with this symptom is they talk about as one being the most distressing symptom that they experience or syndrome, and secondly, and most importantly, they talk about that it's very overwhelming. It sort of changes their whole sense of self. It can actually be isolating in terms of the fatigue that they might experience, and not only does it interfere with good work productivity, but also can have a significant impact on quality of life. So those are some of the words at the bottom that patients use to describe it, that it's paralyzing, that it's overwhelming, and it's draining. It's a feeling of unrelenting exhaustion. And I think one of the most challenging aspects of cancer fatigue is that oftentimes when patients talk about this symptom or problem with their physicians is they're often told nothing can be done about it. So it's often the worst distressing symptom, because often patients hear from their physicians or their clinicians that there is nothing that can actually be done. And the reason you're hearing that is, in fact, because oftentimes when we think about managing a symptom such as pain or fatigue, we think there's one drug that's going to be the solution. I was really struck by, in The Emperor of All Maladies, that again, fatigue has many, many different factors that go along with it that I'll talk about. So there isn't one specific drug that's going to manage this problem. So often if there is no drug, we think there is no treatment. And there are many things that can actually help cancer fatigue. So prevalence of fatigue, just to give you a little bit of background, in terms of most patients experience this. It's almost a universal symptom from both cancer and from cancer treatment, whether that be radiotherapy or chemotherapy. It's one of those symptoms that definitely can go on for many, many years post-treatment, up to 10, 15, 20 years. And the challenge that I heard a lot of you talking about, you're not just experiencing this particular problem, you may be experiencing other comorbid illnesses, so that fatigue is contributing. So I've talked about the burden of fatigue. I think all of you know what that burden is. You've probably been experiencing some of that burden of fatigue. One of the things that we do know about cancer fatigue is it will vary by type of treatment. So again, and the pattern of fatigue will vary by the type of treatment. So patients with radiotherapy will have a sort of more pattern that sort of goes on and on. Patients with chemotherapy will often get a little bit better between treatments, but we do know after treatment, patients can have worsening fatigue in the morning. They can have worse fatigue in the evening than they actually have in the morning. So the pattern of fatigue varies by both the type of treatment, type of cancer, but also age and other illnesses that a person might be experiencing or have alongside the fact that they've had cancer in the past. And of course, it also can vary by gender, by whether you're male or female. And I think that's just because we're all experiencing things very different. As Marg said, we all have our own experience and different way of dealing with these particular problems. So I've given you some idea of sort of the factors about fatigue and what we know about fatigue, and I think the thing that is most challenging about fatigue, as I said, is it is a multifactorial problem. There are multifactorial reasons that we think go along with it. It's very much like the Emperor of Maladies, where they were trying to figure out what are those, that cancer wasn't one disease, that there were many, many different factors that were contributing to the development of cancer and cancer cells. Similarly, with fatigue, there are many, many factors that go alongside as contributing to or causing the fatigue that cancer patients do experience. So sometimes the medical causes could be things that many of you may have experienced, things like anemia. Changes in your blood counts can actually make a person feel more tired, and there's certainly research suggesting that if you actually treat the anemia, and some of those medical causes, that actually you can feel a little bit less fatigued. The problem is that, again, there always isn't just one cause. There may be many, many different causes coming together to contribute fatigue. And I heard someone talk about diabetes as a symptom. Diabetes is also another one of those problems that causes significant amounts of fatigue. So if you have both illnesses going on at the same time, it can be extremely challenging. The other thing about fatigue is that, of course, some of this is at a sort of mechanistic level. that you can actually have loss of muscle mass, and it's not so much that you're undergoing treatment and actually become more sedentary or maybe are resting more. That can contribute to it, but in fact, there's probably things happening at sort of the cellular level, if you will, that contribute to loss of muscle mass, or what we call deconditioning. So in fact, the tiredness can really almost be like you really wore yourself out, because your body's actually responding in such a way that it's almost as though there's a cardiac issue going on. It's actually at that sort of cellular type level that can be experienced. There's also lots and lots of research that all of the things that are happening with fatigue, and especially with fatigue that occurs after treatment, because lots of patients will say, well, you know, I finished my treatment, why am I still so fatigued? You know, I'm 5 years from my cancer treatment has been finished, and I'm still feeling exhausted and overwhelmed with this sense of tiredness and fatigue. And what we think is happening is that there's some kind of inflammation going on with the body, and again, you might have heard the term cytokines, inflammatory cytokines, or other sort of biochemical processes that might actually be contributing to ongoing fatigue that sort of carries on for many, many years after. So there's an inflammatory effect within the body that might actually contribute to ongoing fatigue over time. But this is an area of huge controversy in the literature, and we're not sure what particular types of inflammatory cells cause fatigue. There's lots of literature that suggests it's one kind. Other research will actually refute that and say it's another kind. So that's why you often hear physicians or others say there's nothing that can be done about fatigue, because we really haven't got all the answers, and we don't have the very definitive answer around what causes fatigue from all these underlying mechanisms as well. The other issue, of course, is sleep disturbance. So lots of patients are experiencing other symptoms at the same time: pain, fatigue, distress, emotional distress, as well as sleep disturbance can occur all at the same time. So you have all of that going on, creating this experience of fatigue, or the fatigue problem within the body. And so there's also some theories that suggest that it's not just the fact that we may have significant distress that interferes with our sleep in a situational stress type way, but in fact the problem with sleep is the drugs that you may receive actually disrupt what we call the sleep-wake cycle. They actually have a chemical effect on the brain that may be causing some of the problem with cancer fatigue as well. And of course, stress and depression. Emotional distress is very highly associated with fatigue as well. And it's not that the distress is causing the fatigue. Those two symptoms tend to go together, and we're not sure if it's just because the symptoms are very similar, or whether it's really that the whole body is sort of going through this inflammatory process. And in fact, depression and distress are also related at sort of that biochemical level as well. Post-treatment fatigue is that, of course, it's almost like a chronic fatigue syndrome that other patients might experience who've not even been through cancer situation. And what happens so often, it becomes this vicious cycle of thinking, I need to rest to try and recover so I don't feel so tired. And then what happens, that rest actually aggravates the fatigue and the tiredness worse. And then the stress and that sort of sense of loss of self that Mark talked about, they all start to come into play and create what we call this vicious cycle of fatigue, that it kind of just keeps perpetuating itself. So all of those factors I talked about can continue to be perpetuated. And in fact, there's some research suggesting that if you are less active, there may be more inflammation, and that's sort of typical of what we're seeing with all kinds of different other illnesses, such as diabetes, that the less active you are, you may have more inflammatory chemicals in your body that are contributing to some of this perpetuating cycle. But one of the challenges that we find that a lot of patients face, because they're really trying to sort of get active again, try to sort of invest and sort of try to deal with this fatigue, and they actually go through what we call periods of boom and bust, that they actually over-exercise, and the body's probably very different once you've gone through cancer treatment in terms of this type of fatigue. And then what happens is they'll need to rest for days and days on end. So it's almost like overactive, gee, I got to recover, and the recovery takes longer when you've actually been through cancer treatment. So this perpetuating cycle can sometimes go on and create more difficult challenges with this type of particular fatigue. So of course the first question is there treatment that can help this? So is there anything that we can do about managing post-treatment fatigue or fatigue even during treatment? And I'll talk a little bit about that. There is certainly, again, physical activity, and I'm going to speak a little bit, give you a little bit more detail about some of the studies behind this. Certainly physical activity or exercise, all different types of physical activity actually contributes to a lessening of fatigue, and it's where the strongest science is right now. And actually most of the advertising is talking about that exercise is the medicine we should be thinking about while people are undergoing active treatment, but also post-treatment to recover from fatigue, and I'll talk to you a little bit about that in a moment. The other thing is, of course, that all of the psychological approaches, good management of stress, good management of any of the sort of emotional aspects that you might be dealing with are also shown to have some effect in terms of managing fatigue, but right now exercise is shown as the strongest medicine for treatment of fatigue. And I know that can be really challenging when you are dealing with multiple illnesses. You're trying to balance cardiac disease, you're trying to balance diabetes, you're trying to balance other issues all at the same time. And so even to talk about or think about physical activity can be very challenging to counsel patients around that particular area. Nutritional aspects are important, but the science is not as strong there, but definitely if you have anemia or changes in your blood counts, then you'll actually experience more fatigue, and the treatment for those actually treating anemia has been shown to reduce fatigue in patients. And of course, I'm going to talk a little bit about medications, because this is the area that people sort of want a pill. Is there a pill I can take? Is there one pill that can make the difference to make me feel less fatigued? And I can assure you there is no one particular pill. There are some that might help you, but I'll tell you a little bit about the evidence behind them that you might want to think about. So I just thought I would tell you a little bit about the exercise, but before I do that, I just want to show you the next slide. I think sometimes when I speak about exercise, when people are fatigued from cancer, I sort of feel like I need to put up this slide to sort of say, I know how challenging it is to talk about, oh, you must get more active, and yet I'm exhausted and so tired. So I just thought I should put that slide up to balance what I was saying about the whole area of exercise and the challenge that you might face. But there is very, very strong evidence around physical activity in all cancers, and lots of little less research in leukemia and lymphoma, but that evidence is now emerging that in fact people who remains to have some physical activity even during active treatment, as well as if they can start to recover some physical activity post-treatment, seem to do better in terms of reduction in fatigue, and they may also do better in terms of reduction in depressive symptoms as well. So there seems to be a co-occurring effect from exercise. So it's been shown in many, many trials, and I was able to find 9 trials in particular blood cancers that did show that it was safe to do during cancer treatment, safe to exercise or have physical activity levels that are supervised. Of course, you don't want to just go out again and do this boom and bust kind of thing that can occur, but it does improve fatigue, quality of life, and physical function as well. So there's lots of trials that show that physical activity does make the difference. There's all kinds of other benefits, of course, the cardiovascular effects, the better sleep and quality of life changes that can occur. And of course, there is some evidence in some cancers that, in fact, physical activity may be a preventive measure for cancer or preventing cancer, but also might be something that actually avoids cancer coming back again if physical activity. I think what they're hypothesizing or suggesting is that, again, physical activity has been shown to reduce those inflammatory mechanisms that are going on in the body, as well as really good nutrition. So the hypothesis is that there's a link to reoccurrence or disease coming back or longer-term survival, but it's not proven for all cancers yet. And as I said, the area of hematological or blood cancers has the least amount of evidence and research in this field, so it's interesting. I think because people thought you really should not be exercising when your blood counts are so low and you're going through cancer treatment, but they've shown it's quite safe. So that was my, just so you can see, these are the prescriptions for normal sort of physical activity. And of course, you're older, then you want to also do balancing exercises. So the suggestion is, 150 minutes per week of sometimes of moderate intense. And what we have found in the research now is, in fact, it doesn't matter what type of exercise. There used to be a belief that it had to be full-out aerobic cardiac exercise, where you're going to the gym. But that's not true anymore. We're actually finding that fast walking Sometimes if you really do sort of a strenuous type of yogurt, that they're all equally effective. And you can actually think about these 150 minutes by dividing them up over time. You don't need to do them all at once. You can actually do 10-minute increments over a day. The most important thing about any of this is that you need a combination of both strength training and physical activity, but the most important of any of this is you need that supervision or help around what we call graded, individualized exercise prescription. As I said earlier, I wouldn't want you to get into that boom and bust situation. Some particular precautions when you actually have blood cancers, of course, is thinking about your blood counts. You do need to, there is some safety precautions around exercise and some suggestions that you should be avoiding more vigorous exercise and doing the more gentle type of exercise when your blood counts are down. And that's just giving you a little bit of a chance of that. And again, any kind of exercise is okay, and any kind of physical activity. So there is also some mind-body interventions that have shown that they are likely effective, but the evidence is a little less strong. But certainly patients report better reduction in fatigue when they're doing mindfulness strategies, when they're doing yoga or other types of strategies, those sort of mind-body sort of medicine aspects. And there's certainly some research that suggests both, as Mark says, really good information and knowing what to expect in the pattern of fatigue makes a difference, but they're not quite as strong an effect on reducing fatigue. And the other aspect, of course, is what we call behavioral interventions, which help patients to change their thinking and thoughts and feelings about a particular problem, can be helpful, but at the same time, that needs to be combined with a different type of behavior that you're actually activating in a graded way that patients can actually take on a different level of physical activity. How am I doing time-wise? Sam, are you okay? Okay. So the other thing that can, I said earlier about the medicines, and we always think about, is there one particular pill, because we might feel so particularly awful with this fatigue that we might be looking for that one solution that might make a difference. And sometimes a combination of all these things are probably helpful. But in terms of medication, so of course we always have to think about treating the underlying cause. So if you're, at your physician's and talking about your fatigue experience, they should still be doing a physical exam. They should still be looking for underlying conditions that might be contributing to fatigue, such as anemia. Cancer treatment can cause reduction in thyroid hormone, so thyroid changes can occur. In addition to that, as you've mentioned, the whole aspect of cardiac disease can come into play, or other illnesses, diabetes, that actually occur sometimes as a result of treatment, and also as a result of survivors just getting older and having all those diseases come into play at the same time as they're surviving post-cancer. So all of those things should be treated. Of course, depression, underlying depression should be treated as well. But there's very little evidence around medications, particular medications, although there are single studies, and you might be a good example of that some patients will talk about a reduction in fatigue from some medications, and many of the medications are what we call psychostimulants, or kind of wake-up drugs. Exactly. So those wake-up drugs, called methylphenidate and all those, there's all kinds of different names. They've been using these thinking if we kind of wake people up, they're almost like an amphetamine kind of approach. If we actually use this, that it might actually help people to reduce their sense of fatigue or tiredness. And there are some single studies that suggest it does, but overall the evidence is very weak. And it's not strong to suggest any type of particular medicine will actually reduce cancer fatigue experience or the feeling of tiredness. And often patients will ask about, well, what about complementary therapies? Can I take things like ginseng is well advertised as a potential solution for cancer fatigue by herbal agencies or agencies that work, health agencies. And we tested all of these things. We reviewed all the evidence in terms of CQ10, ginseng, L-carnitine, and also acupuncture. So acupuncture has shown certainly some reduction in fatigue, but the studies are not of the high quality yet that we can actually say these are the things you must do because they will reduce your fatigue. So these herbal medicines, Chinese herbal medicines, and these other kinds of medicines don't have strong proof. But again, it's almost like you have to sometimes sort of try these different things, because there are some single studies that show they do help some people feel a little bit better, but there isn't sort of a high quality evidence, what we call high quality evidence, to say everybody should have L-carnitine or ginseng or any of those kinds of things to manage the problem. So what can you do about managing fatigue? So I've kind of given you lots of different sort of ideas. Again, a lot of it has to do with can you change, can you look at your diet, can you look at nutritional aspects, can you actually get a counselor around diet management? Thinking about your sort of energy store as a bank and avoiding that sort of boom and bust of activities is really important. Managing stress, managing the whole area of sleep hygiene, and I like the idea about the going on holiday idea, because in fact what happens with cancer, as all of you know, is that you start to cut back on your roles, your relationships, your activities, and that leisure aspect of your life. We forget that there's a whole side of life that you had before cancer, and we sometimes are slow to reinvest in all that sort of social capital or leisure activities, and those become really important ways to manage fatigue that become incredibly important. The other thing you want to think about is communicating about fatigue. So this is actually a Marg scale, which actually helps you to actually talk about your fatigue and describe your fatigue to your practitioners, and then how much it actually interferes with your daily life. Because again, practitioners may think about, oh, well, you're tired, of course, you had cancer, you had treatment, of course you're tired. They don't really understand how much of an impact it might be having on your daily life, and you need sometimes to communicate about that, because that's where they start to go, oh, I didn't realize you were so disabled by the fatigue that you're experiencing, and we need to think about getting you to a rehabilitation clinic or a supervised program where they can really help you to manage this problem. And those are just some resources for self-management of fatigue, and I think in your booklets you've got some of the ones that was put forth by the Canadian Partnership Against Cancer that Marg talked about that might be helpful as well. So just in summary, fatigue is an almost universal problem. It's a long-lasting issue. It's a post-treatment problem. It's one of the most distressing, and patients talk about fatigue as being more distressing than sometimes pain or the other issues that they might be experiencing in post-cancer treatment. And of course, the burden is really high. So we really need to think about this as an area of where there's need to be more research being done and more understanding of not only the biology and underlying aspects of it, but actually to think about how we need to understand some of the genetic role and the inflammatory aspect that might be contributing to fatigue that also needs research to move forward in this field as well.